It's Terrell Walker. I have Jillian Turner, a physical therapy assistant at Alabama Physical Rehab Services here with me. I'm going to be interviewing her and asking her a few questions today. The first question I have is, why did you choose to become a physical therapy assistant?
My mother was in a really bad car wreck the summer of 2003, and that involved, she broke her fibula and tibia, and so that was an extensive surgery, rehab, and physical therapy. So I would come with her, and she actually came here where I'm working now, and I would come with her, and that's the first time I was ever around any kind of physical therapy or any kind of treatment like that, and I just loved it. I loved what they did for her. They taught her to walk again, made a big impact on her life, so I want to do the same thing.
Okay. What does your daily duties and responsibilities consist of?
Daily duties and responsibilities. As a physical therapist assistant, with every patient that comes in, I have to assess them upon first, seeing them that day. In the first few minutes, I need to have an assessment on them, their pain level, if there's exacerbated pain, if there's exacerbated symptoms, or if there's improvement. That's going to affect the treatment for the day. That's going to affect if we progress with the exercises, we progress with any kind of treatment or manual work, manual therapy, or if we have to modify certain things. So that's one of my duties. Another one is I have to follow out with each patient as well the plan of care of the PT. I have to follow out any kind of changes he's made, any kind of advancements he's wanting. I have to make sure that his plan is followed out the way he has assessed and diagnosed the patient.
What would you say is the most important quality to have working in the field? Like, if you could just use one word or one characteristic.
You have to love people.
Mm-hmm.
You have to be patient.
Right.
People in pain are not always, excited to be around you. They're not always happy and everything, but they're coming to you because they're hurting, and you have to be patient with that. You have to be sympathetic to it, but you also have to be willing to know when to be stern enough to push them to achieve their goals.
Right. And
everything. So, you have to be patient, really have to love being around people, but then you gotta know when to step in and be stern and kind of aggressive.
Oh.
And encouraging.
How would you say my performance has been during my time here doing my internship?
I think it's been really well. I think you've been attentive, and I think you have gotten used to the patients coming in.
All right.
And I think with that, you've learned which ones need, different modalities and everything. I think you've really observed us working with the kids and everything. You've kind of seen how working with pediatrics, it doesn't always go as planned.
Right.
You got to modify. You got to stay on your feet and everything. So I think you've done good. I think you've observed, and I think you've been able to help and to aid. When we need it, and we haven't had to ask you, because you've kind of, from observing and watching, you've kind of learned which patient needs what.
And my last question, what would be the best advice that you have for me, like going into a PTA program?
Let's see. Excuse me. Best advice. Don't give up.
Right.
Don't give up. There's a lot